Welcome to the deep dive. We're really getting into it today, talking about how antibiotics are dosed for patients in intensive care.
Yeah, it's a big one.
It is, and we've got this super interesting article someone sent us about it. So we're excited to dig into all of this with you. It can be, well, pretty serious stuff,
It
right?
really is. I mean, for these patients, getting the dose right, it can be the difference between life and death.
Okay, so no pressure then.
Right.
For those of us who might not, maybe we haven't looked at critical care protocols recently, what exactly are we talking about here?
So, at its core, it's about how the body handles medicine antibiotics, specifically when a person is critically ill. And what the article really brings to light is just how different that process is compared to someone who's generally healthy.
Okay, so could you break that down for me? The article uses the term altered pharmacokinetics. And to be honest, I'm not totally sure what that means in this context. What's happening in the body that changes things so drastically?
Okay, so picture this. You've got this delivery service, right?
Okay.
They've got their regular routes. They know all the shortcuts, how to get a package delivered quickly, efficiently. Now imagine a huge storm hits, flooding the roads, causing traffic jams, completely messing up their usual routes. That's kind of what happens inside the body of someone who's critically ill.
So the delivery system, it basically gets thrown out of whack.
Exactly. Instead of this smooth-running delivery route, there are detours everywhere. We're talking fluid shifts, organs that aren't working at their best, inflammation, even changes in the protein levels in the body. All of these things can affect how the medication, how the antibiotic gets absorbed, how it travels through the body, how it breaks down, how it's eventually eliminated. It's all different.
So those dosage instructions you see on the medicine bottle, those might not really, they might not be accurate in these situations.
That's the heart of the issue. The doses they give you for antibiotics, they're usually based on studies of healthy people.
Hmm.
But giving that same dose to someone who's critically ill, it might not be enough. Or, and this is the scary part, it could even be harmful because their body just isn't processing it the same way.
That makes a lot of sense. Now, another thing I noticed in the article, it used the abbreviations PQPD and TDM a lot. And honestly, I'm drawing a blank. Is there something we're missing here?
Well, think of it this way. PKPD, it's like understand the antibiotic's whole journey from start to finish.
Hmm.
Pharmacokinetics, that's the PK part. That's like our delivery service, how the drug gets to where it needs to go in the body. And then pharmacodynamics, or PD, that's all about what happens once the drug actually reaches its destination. How well is it fighting the infection? Is it doing what it's supposed to do?
Okay, so we know where it goes and what it does. But where does the TDM come in?
TDM, that stands for therapeutic drug monitoring. And this is where things get really interesting. Imagine we want to time that delivery perfectly. TDM, it's like we've got a GPS tracker on the package. In this case, we use blood tests. These tests allow us to see exactly how much of the antibiotic is actually in the patient's blood at different times.
So it's not just a one-size-fits-all approach. We're talking about really tailoring the treatment using feedback we get from the patient's own body.
Exactly. We're making sure that the antibiotic actually reaches the infection, that it's at the right concentration when it gets there, and that it stays there long enough to actually be effective. And the research is increasingly showing that this kind of personalized approach, it can make a huge difference for these patients.
It almost sounds like we're moving away from a general map and toward turn-by-turn directions that are specific to each person, right?
Yeah, that's a great way to put it. And this is where it gets even more detailed because the article goes on to talk about specific types of antibiotics and what they target in the body.
Yes. And that's what I found so interesting. We're not just talking about some theoretical medication here. These are real drugs that we're giving to people who are very, very sick. What are some of the things our listeners should know about this?
Right. Well, the article uses an example that I think a lot of people will recognize. Vancomycin.
Okay.
It's an antibiotic that's been around for a while, and we've gotten pretty good at figuring out how much a patient needs to actually be effective.
So we've kind of like perfected the recipe over time.
That's a great way to think about it. You need the right ingredients, the right amounts, the right temperature, the right amount of time.
Yeah,
With antibiotics, we're aiming for that same kind of precision.
it makes sense.
Yeah.
Now, the article also mentions some limitations with how we're figuring out these dosages. And it sounds like it's not quite as simple as just, plugging numbers into a formula.
You're absolutely right. It's a lot more nuanced than that. Yeah. One of the big challenges is that infections, they're not static. They're always changing. It's almost like trying to predict the weather. Right. You can look at the forecast, but there are always these unforeseen things that can pop up and change the outcome.
Exactly, yeah. So how do we deal with that unpredictability when we're trying to treat these infections?
That's where the ongoing research comes in and the really cool technological advancements we're seeing. For example, they talked about developing even more advanced computer models, models that could actually take into account all of the many complexities of an infection and how a person's body might react to the medication.
So almost like a supercomputer that helps us personalize treatment even more than we can now.
Exactly. These models could look at a patient's specific situation, the type of infection, their medical history, their genetic makeup even, and use all of that to predict how their body is going to handle the antibiotic and then determine the most effective dose.
That sounds incredibly promising. What about these rapid genetic tests they were talking about? It seems like those could get us closer to this real-time, personalized approach.
Absolutely. Imagine being able to identify the exact bacteria causing the infection, not in days, but in hours.
Wow.
That would let us choose the most effective antibiotic from the get-go, potentially stopping those complications before they even start, much better outcomes.
It's about getting the right treatment to the right patient at the right time, right? No more guessing games.
You got it. And it's not just about the initial diagnosis and treatment. The article also talks about how we can actually monitor drug levels in real time using things like wearable sensors or even microsampling to constantly know how much of the antibiotic is actually reaching the infection site.
Wow. So we could adjust the dosage on the fly based on real-time data.
That's the idea. It'd be like having this constant feedback loop, always making sure the treatment is as fine-tuned as possible. And then when you add in the power of things like artificial intelligence and machine learning, well, we can start to analyze massive amounts of data from clinical trials, from individual patient records, to identify patterns and make even more precise decisions about treatment.
AI seems to be popping up everywhere these days. It's pretty amazing. But in this area, this field, what would you say is its biggest potential?
Well, one of the biggest things is that AI could help us predict which patients might be at higher risk of complications or even antibiotic resistance.
Okay.
We're talking about being proactive, not reactive, you see, preventing problems before they even arise.
That's incredible.
Yeah, we could use AI to create completely personalized treatment plans, making sure that those who are at a higher risk are getting monitored more often, or maybe even given alternative therapies.
It sounds like it could revolutionize not only how we treat infections, but healthcare as a whole.
I think so. We're
Yeah.
really seeing a shift towards a more personalized and precise way of practicing medicine, and that's exciting.
It really is. We've covered so much from the
Yeah.
complexities of how antibiotics work within the body to these futuristic technologies that could change everything.
That's a lot to think about.
It is. So if you had to pick, like, what are the one or two biggest takeaways you want people listening to walk away with?
Well, I think for me, the biggest thing is that this isn't just about, science and technology.
Oh.
This is about people.
Yeah, absolutely.
At the end of the day, it's real people who are dealing with these sometimes really scary illnesses. And all of this research, all of this incredible technology, it's all for them.
And even though we've made so much progress, there's still, it feels like we're always learning new things, right?
Absolutely. Medicine, it's always changing, always evolving.
Yeah.
What we know for sure today, tomorrow, that could all be different. I think that's what makes it so fascinating.
Yeah, it's like we're putting together this giant puzzle, always looking for those missing pieces to help us see the full picture.
And each new thing we learn, every time technology advances, it brings us a little bit closer to seeing that complete picture.
It's exciting to think about what we might be able to do in the future.
It really is. I mean, we're talking about maybe even being able to, like, wipe out certain diseases altogether, designing treatments for each individual person, helping people live even longer, healthier lives. The impact is huge.
It's a good reminder that even when we're facing these really complex, really difficult challenges, there's always hope. There's always this drive to make things better.
That's what keeps us moving forward, that desire to find answers, That's how we make those breakthroughs, the ones that can change the world.
Couldn't have said it better myself. So for all our listeners out there, for anyone who's been on this wild ride with us, what's the one thing you really want them to hold on to as they go about their day?
Don't stop asking questions. That's what drives innovation. Never lose that curiosity.
And speaking of questions, we'd love to hear from you. What really stood out to you in this episode? What are you thinking about now? Connect with us on social media and let's keep this conversation going.
We learned so much from hearing your perspective, so don't be shy.
And on that note, thanks for joining us for another deep dive. We'll see you next time, but until then, Keep exploring, keep that curiosity alive, and keep asking those amazing questions.